My name's Nick Majerus and welcome to Top Med Talk. What does it mean if your patient DrEaMS? Well, it could mean, from a perioperative perspective, that they're drinking, eating, mobilising and sleeping. DrEaMS. In this piece, Dr. Geoff Lacey pushes Dr. Ramani Moonesinghe on the subject of the Perioperative Quality Initiative Outcomes paper, and she refers to DrEaMS. Have a listen.
May I also press you on with the POCI outcome paper?
Sure.
You, towards the beginning of the paper, you and the other authors specify that you almost want to take a slightly didactic stance on which outcomes to measure, and you admitted that sounded slightly disingenuous. You know, if something is working, it shouldn't matter how you record it. But do you mind explaining that rationale and why that's important?
Sure. So I think the classic example, the old joke about two, I don't know how rude I can be, two orthopaedic surgeons
as rude
looking
as
at an ECG. Two orthopaedic surgeons looking at an ECG is the equivalent of a double-blind randomised trial. That old joke, there is actually, as with all the best jokes, there's some truth in it. If you ask different people to look at a chest x-ray or a patient or whatever and make a diagnosis of whether or not they've had a chest infection or some other complication, then you'll often get a little bit of inter-rater variability in decision-making on that. You add into that the complexity of collecting data for the purposes of audit or quality improvement or research on top of that, and without very, very high levels of training, which I know the NSQIP surgical case reviewers do get, but is not always possible in more resource-constrained settings, there is a real risk that different hospitals will record different complication rates, not because they truly are different, but because the data are recorded imperfectly. So the choice of outcomes to measure, one of the key considerations is objectivity of the assessment. So don't necessarily say, is it a chest infection, but use an objective measure such as whether or not the patient's receiving a particular therapy to enable us to make the diagnosis or the record the complication for the purposes of audit and improvement, which is one of the reasons why the DrEaMS concept is a great one, because the patient can complete that themselves, and so it's very resource light. Or alternatively, staff can do it for them, but there isn't much doubt about whether or not a patient's had a drink or had something to eat or has got out of their chair and started walking about. So using simple objective measures like that, I think, is really, really critical.
So, Ramani, that's all fantastic work. The lines are now completely crammed with orthopaedic surgeons who'd like to have a chat with you. So we're going to let you go, Ramani. Thank you very much, Lee. Congratulations on all the fantastic work. That's Dr. Ramani Moonesinghe, who is the current director of the Health Services Research Centre at the Royal College of Anaesthetists.
Top Med Talk. Please remember to subscribe to Top Med Talk for more quality content like this coming out every single day at the moment. And of course, don't forget to check out our website, topmedtalk.com.